Hey y'all, I am so glad that you joined us today. My name is Kyla Molina and I am a licensed therapist here at the Oklahoma City Indian Clinic. And I just kind of wanted to talk with you for a minute and bring you some updates with this new experience with the COVID-19. Those with mental health disorders are going to be more susceptible during this time, and it can be a really scary experience. So we want to come on here and give you a couple of updates that could help you through this time. Things like anxiety and depression can be really big concerns during this time, and so we want to make sure that you have all the resources you need to be able to be safe and move forward. If you're living with certain mental health disorders, it's important to know when these emotions are becoming overwhelming. And in order to anticipate escalating emotions, we want you to be prepared. It's important during this time to be prepared as much as possible, so we want to give you a few tips to create a plan. Step one is to be able to contact your providers to refill any medication needs that you have during this time. As a clinic, we're moving solely to virtual visits where you can be able to connect with your provider via microphone and telemed, so face-to-face, but through a smart device, so your cell phone or your computer. It's really important for you to call your provider to be able to get those visits set up ahead of time, because as this time grows, getting appointments and getting refill medications could become more difficult. It's also really important to keep the same routines. So waking up on the time that you'd normally wake up, making meals for yourself at home, and implementing things that are going to benefit your mental health in the long run. This also includes keeping your nighttime routine, going to bed at a decent hour and continuing to wake up. Third, know your support, and maybe reach out to new support that you haven't thought about before. Find online groups that you can reach out to or people that you can interact with via social distancing. We also want to make sure that you have the suicide prevention hotline number, which is 1-800-273-TALK. Write this down or have it in case of times where emotionally you might get overwhelmed. Another important tip could be to limit your news intake and accurate information. There is a lot of information out there that's being reported that might not be accurate, and we want to make sure that you have the most accurate and up-to-date information. So relying on specific websites like the cdc.gov to give you updated information. Finally, during this time, know that OKCIC is here for you. If you have any questions, feel free to contact our front desk at extension 610.